Oh, hi. I didn't hear you. Come in. My name is Dr. Cam, and I am a scientist. I'm not a scientist. I also don't wear glasses, but it makes me look more like a scholar. But I promise you, those will be the only inaccurate things about this video. I am here to discuss a disorder that relates to human health and disease, and that is spondylolisthesis. And on top of being hard to spell and pronounce, it's a spinal disorder which affects the lower vertebrae and results in lower back pain, as you can see here in this diagram. Spondylolisthesis is defined as a displacement of one vertebra over the next lower vertebra in the sagittal plane. And the sagittal plane basically is at the bottom of the spine. It separates the left and the right sides of the body. And there are 33 vertebrae in total. Spondylolisthesis specifically affects the lumbar area, which is the 5 vertebrae in the lower back. The name spondylolisthesis is made up of a combination of spondylio, which means spine, and lysis, which means slippage of the spine. Symptoms of this disorder include, and I have one for every syllable, lower back pain, pain and or weakness in the thighs and or legs, tight hamstrings, tenderness, and general difficulty with standing and walking. The disorder differs from spondylolisthesis in that it specifically concerns a lower bone in your spine. The two aren't necessarily mutually exclusive, however, as spondylosis can be a precursor for the latter, since the fracture is yet to fall lower onto the spine. Spondylolisthesis occurs in 5 to 6% of males and 2 to 3% of females. It's more likely to occur in males just because we engage in more physical activity. Sorry, ladies. And also, men, not just men and women who engage in physical activity are more likely to develop it. Specifically those who engage in strenuous activities like football, weightlifting, gymnastics, etc. Causes of the disorder, other causes of the disorder vary. It may be present at birth and develop later in childhood or even adulthood, and that's known as the developmental kind. Or it could be the result of specific daily stress or stresses. That's known as the acquired kind. Something like the acquired kind to be developed from, say, like a fall from a ladder and then landing on your feet. And otherwise, the causes could be age, heredity, lifestyle. There's several different ways that a patient can determine whether he or she has spondylolisthesis, such as basic exercises, x-rays, and CT scans. Here's a little x-ray of a person who has spondylolisthesis, and there's a little arrow pointing to the fracture in the lower part of the spine. And there are 5 different grades of spondylolisthesis. There's grade 1, which refers to 25% of the vertebral body has slipped forward. Grade 2, more than 50. Grade 3, more than 75. Grade 4, more than 100. And grade 5 means that the vertebral body has completely fallen off. And this is known as disorder as spondylolisthesis. And that's even harder to say. According to an academic article from the International Archives of Integrated Medicine, high-grade spondylolisthesis, or HGS, is defined as greater than 50% slippage of a spinal vertebral body relative to adjacent vertebral body. And as you can, I have a little diagram here. This basically shows the different grades. So here's a normal kind, and basically, by the end, the fracture has resulted in the body completely slipping off. And high-grade spondylolisthesis is rarely covered in chiropractic literature, as mentioned in an article from the Journal of the Canadian Chiropractic Association. It's mentioned so little precisely because it is so rare and difficult to treat, even if it's symptomatic. Spondylolisthesis can be treated through both therapeutic and surgical means. Therapeutic forms include treatment, of course. I'm the stuttering scientist. Therapeutic forms include wearing a back brace, engaging in physical therapy, lots of rest, and anti-inflammatory drugs like ibuprofen, and steroid injections. Indications for surgery, if that's necessary, include slip progression, significant deformity, and postural imbalance. And there are other factors involved, but they're very complicated to name. The spinal fusion surgery involves using a bone graft and metal rods together as an internal spine within the body. And the goals of either type of treatment, basically to heal the fracture and the vertebrae, reduce the pain caused by this fracture, and eventually achieve stabilization. So basically fix the spine completely. And to conclude this little tutorial about spondylolisthesis, I've decided to interview my mother because she's actually been affected by spondylolisthesis. She's not sure whether she has acquired or developmental kind, or also what grade of the disorder she had, but nevertheless she experienced quite a bit of pain as a result, and she required a spinal fusion surgery 6 years ago. So enjoy my interview, and when I catch you next time, hopefully I'll actually have a PhD. So thank you.